Uh, I have a guest, a, a dental therapist, who will enlighten us on what he calls tooth fracture, tooth fracture.
Correct.
So today he will do most of the discussion while we chip in some questions later. Our dental therapist, you are well known to most of our listeners, but for the sake of those who may be listening to us for the first time, kindly introduce yourself and whatever you feel we need to know about you.
Okay. Good morning to all our listeners. My name is Habila Gayus Kombo, a dental therapist with ECWA Hospital Egbe. And today again we will be doing justice to teeth fracture, which is very, very common to many people. In every age you find out you must see fracture. So in the future of the introduction of the topic, I'll be able to explain more on it before we go through the question. But before then, you can reach us on this number or text messages. You can ask questions for more enlightenment on this topic or any other topic of your choice. On this number, 090 94117744. Let me repeat it again, 090 94117744. And the other number you can reach us again is 090 09023220568. Thank you.
Thank you, guest. What exactly do you mean by teeth fracture?
Okay. Teeth fractures. When we talk about teeth fracture, these are remarkably, tooth is very, very strong, but they can also chip, crack, or break. This can happen in several ways. One of the ways you can, fracture your teeth is biting down on something hard. Probably when you are eating maybe a bone or anything that is hard, you can fracture your teeth. Being hit in the face or mouth, you can also fracture your teeth. Or probably you fall. When you fall, you can also have tooth fracture. Or when you have cavities that weaken the tooth, so they also can, your teeth can also fracture. Or having large old amalgam fillings that don't support the remaining enamel of the tooth. So when a tooth chips or breaks, it may not hurt. However, your tongue usually feels the sharp area quite quickly. Minor tooth fractures usually don't cause pain, but if a large piece of the tooth breaks off, it can hurt. The nerve inside the tooth may be damaged. So we advise a lot of people. You might experience such kind of things, and most especially those of us who uses we take soft drinks. When you take soft drinks, maybe you visit someone and they offer you a bottle drink. You quickly, instead of waiting for an opener, you quickly just use your teeth to open those drinks. You might likely fracture your teeth at that stage. And that is the kind of fracture we call chip-in. When you chip in the teeth, you might not experience sharp pain at that stage. But because you didn't feel pain, you felt, oh, I'm okay. But the truth of it, you have a serious problem that will end up, if care is not taken, you might even end up removing your teeth. So we advise a lot of our listeners listening to us now. Don't wait. That's why this program is very important. We advise our listeners, you don't need to wait until you have toothache. you just have to rush to the hospital in order to take care of your teeth. Extreme discomfort also can happen when nerve endings in the dentin are exposed to air, or to hot or cold foods or drinks. Pain from a broken or cracked tooth may be constant or may come and go. Many people feel pain when they chew because chewing but puts pressure on the tooth. So the tooth fracture can happen, but the pain don't usually stay sometimes, except it got to a bad state whereby it affects the pulp chamber of the teeth, because the tooth comprises of 3 layers: the enamel, the dentin, the cementum, and then the pulp. The pulp is close to the roots. So when the crack of the tooth or your teeth break, if it penetrates onto your pulp, the roots, then it gives you sharp pain, which will make you at the end of it, maybe you will not even be able to sleep. But there are a lot of people who, when they have cracked tooth, they only experience the pain while eating. You understand? But apart from that, the pain usually comes and goes. Thank you.
Having said, you cite the example of somebody opening soft drinks without opener.
Yeah.
What are the other causes of tooth fracture?
Okay. Some of the other causes, as I mentioned earlier, maybe, when you bite anything hard, for instance, you're chewing bone. When you're chewing bone, you will definitely, likely experience tooth fracture. Why? A lot of us there are bone, though, I don't think human beings should eat it. I don't think the human beings should use it. But you find people trying to struggle with that kind of bone. So biting harder will end up making you having a lot of issues. So I advise a lot of people, there are bones that are made for animals. Just throw it to them. Because when you ask people that come to the hospital, they'll keep telling you, oh no, I was just eating fish. Somebody might not even tell you the truth. Because I remember some of the patients that usually come complaining of crack on the teeth. They will tell you it's a small bone, and whereas maybe the bone is not just ordinary bone. And even if it's just ordinary fish, you say you are eating, then you fracture your teeth. Then it means that your dentin, the enamel also is no longer strong. So since it's no longer strong, because the more we get older, our teeth tend not to be stronger than while we were coming. So I advise people, because your nerves are at least getting aging. So I advise you also watch the kind of food you eat. Then the other cause I also mentioned is when you fall. When you fall, you can also crack your teeth or you fracture your teeth. And when you also hit, maybe somebody hits you during fighting, you can also have tooth fracture. The other cause of it is when you have a hole on the teeth. And when you have cavities, the teeth will start breaking one after the other, one after the other. So all those ones also are the causes. And then when you have old amalgam fillings, fillings that have been stayed for more than 20 years, you might also have a kind of, the teeth will start breaking one after the other. Thank you, sir.
Dental therapist, there's this common saying that some type of mouth brush, and even fluoride can erode part of our teeth. How far is it true?
Yeah, this is a very good question also. We have 3 types of toothbrushes: soft, medium, and hard. Soft is for little children and possibly those who have bleeding gums. And then medium toothbrush is for you and I, adults. And then hard toothbrush is for smokers. And even the smoker, there comes a time we advise them, hey, you guys, you don't need to continue using that hard toothbrush because it erodes your enamel. It erodes part of the teeth, the whitish part of your teeth. The more you keep using the hard toothbrush, and you are also brushing wrong techniques of brushing, you are probably causing more danger to yourself. And we have a lot of patients who will come and tell us that, doctor, I can't, if I brush with a soft or medium brush, I don't clean my teeth except the hard one. So it's not about you using the hard one. It's just that you don't know how to brush. If you know how to brush with the medium toothbrush, I guess you clean up all your teeth. But because we don't know how to brush, we insist on using hard one. That hard one erodes your teeth. Please, to our listeners, please don't go and buy hard toothbrush simply because it will clean your teeth. The advice is that go to a specialist and ask for more clarity when you're confused with some of these things. Thank you.
In case either through accidental occurrence or during quarrel or whatever, when one notices that he has a tooth fracture, what do we do?
Okay, this is a very good question. Because I believe that you see somebody with a cracked teeth for more than 20 years, 40 years, with a half teeth in front of him. Whenever he smiles, you observe such things. I usually laugh and smile because, a lot of people do not even know that I can go to a hospital and they can beautify me back. That's the issue. So when you notice that you have cracked teeth, there is a way to treat, or there is no way to treat a cracked tooth at home. That's just the truth about it. You need to see your dentist. Sometimes the tooth looks fine, but it hurts. So I advise a lot of our listeners, you try at all costs to make an appointment with the dental clinic. They will tend to do it in a way whereby will take care of it. A lot of us do smile with a half tooth. It's not good. It's not advisable. So try at all to visit the dental clinic, because at times it hurts, at times it doesn't hurt. But sometimes when the temperature changes, you tend to have a sharp sensation. Like if the weather changes, the weather is very cold, or you take anything cold, you start having sensation. So I advise a lot of our listeners, when you experience such thing, make an appointment with the hospital. We will definitely do something. And when you have a kind of a broken teeth, by biting or hitting, those ones, I advise that you do the best you can to visit the dental clinic. If not, you have a lot of problems. Why? For instance, they use punch to hit your mouth and you're bleeding. The only remedy I can advise you to do at home with that is for you to use warm water with salt. And having done the warm water with salt, the bleeding stops, then make an appointment to come to the dental clinic so that we'll be able to take care of the teeth. If not, you will end up having swelling. And from that swelling, you will have what we call abscess. And then when you now have abscess, that's an infection now. And then if care is not taken, it will even destroy the bone that surrounds the teeth. Thank you.
Thank you. When you say we need to visit the dental clinic, as a professional, what do you do? How do you go about tooth fracture or broken teeth?
Okay. For instance, you have a broken tooth on your incisors. I'm talking about the front teeth. When you have incisor fracture, I advise for you to come to the dental clinic. When you come, we'll take an X-ray of that teeth. And having taken the X-ray of that teeth, I will look at it. Has it affect your pulp? If it doesn't affect the pulp and there is no infection, then I will recommend a root canal therapy. is a treatment we call root canal therapy. I haven't done the root canal therapy to you, then I will advise you to wear what is we call crown. We have different types of crown. The crown means that we'll construct a cap on your teeth and then fit in, so that whenever you smile, nobody will even realize that you were having a cracked tooth, or nobody will even realize you were having a broken teeth. You understand? So for those of us who have cracked teeth, I advise for you to come. And for those of us who have a broken tooth, maybe the tooth is divided into two. The remedy is not just for you to sit at home. The remedy is for you to come to the dental clinic. Because when you come, I'll be able to look at it, take x-rays, and then offer you solutions. Thank you.
During your discussion now, from my own understanding of your explanations, you mentioned cracked teeth, chips, at the same time broken cusp. What is the difference? What is the difference between the three? Cracked teeth, chips, and broken cusp. How do we know the difference? And how does the pain differ, or the cost of maintaining it? Does it differ?
Yeah. Even
or do you go up by the? Is the approach toward remedy different or the same?
You know, when we mean by fractured teeth, there are several types of teeth fractures and breaks, each of which require different treatments and a different approach. When I mention minor cracks, when you come to the dental clinic, we usually call it also a crazy lines. Because the fracture, it's we that will be able to use our instrument to observe it. These are surface cracks that affect only the outer white surface, that is the enamel. So, and we call that kind of a fracture minor cracks. Rarely, those ones don't need treatment, because you will be experiencing a shocking sensation. But however, your dentist may lightly polish the area to smooth out any rough spots. So that is about minor cracks. And when we talk about another one, cracked tooth, this type of fracture involves the whole tooth, from the chewing surface all the way down to the nerve. The pieces remain in place, but the crack gradually spreads. Cracks can sometimes be repaired with filling material. The tooth often will need a crown to prevent the crack from getting worse. If the pulp, nerve, and other live tissues is damaged, you may need a root canal as well. So that is about cracked tooth. You need a root canal therapy before using the crown. Then the other one is chips. Minor chips don't always need treatment. Your dentist may suggest repairing the damage with filling material to prevent it from getting worse, or to make the tooth look and feel better. If the chips is very small, the dentist may polish and smooth out the chipped area. These chips is a little bit the same with minor cracks. So the same management goes the same way with chips and the minor cracks. Then broken cups. These breaks affect the pointed chewing surfaces, the cups of the teeth. They usually do not affect the pulp and are unlikely to cause much pain. Your dentist may repair the damage to restore the tooth shape frequently. However, we advise that a crown usually is required when you have this kind of fracture. Then the other one I will also talk about is serious breaks. When you have serious breaks, these breaks go deep enough to expose the nerve. They almost always cause the tooth to hurt and be sensitive. Usually, the broken part of the tooth will bleed. You will need root canal treatment to remove the exposed nerve, and probably a crown to restore the tooth to normal function. So you can eat and also chew properly. Then the other one I will also talk about is split tooth. This means that the tooth has split vertically into two separate. And that was the one I was trying to mention earlier. We have a lot of patients who will tell you they're eating bone and then probably the tooth is divided into two. You don't need to say that term. Such we call it a crack, and mostly it happens to molars. That's the one we usually use to chew. When you have this more than one root, it may be possible to keep one of the roots, which will then be covered with a crown. First, you will need root canal treatment. Second, the dentist will remove any roots that cannot be kept. Then third, you will need a crown to cover the root and replace the tooth. In some cases, when a root canal cannot be saved, the tooth will have to be removed. So I advise a lot of our listeners, when you have this type of crack, don't wait, because delay is always dangerous. If care is not taken, you might end up removing your teeth. So I advise people, when you have this type of fracture, you come. Then the other one, we call it vertical breaks or split roots. That's another also very bad fracture of the teeth. These cracks start in the root of the tooth and extend upward toward the chewing surface. These breaks are often painful because the area around the root may be inflamed or infected. In most cases, the tooth will have to be removed. So sometimes you just see somebody's teeth, swollen, coming out with abscess. And the abscess, at times, it comes and goes, comes and goes, it comes and goes. A lot of people comes to the hospital with that thing. And some of them even go to the pharmacist to get medication, antibiotics. But the advice I always advise our listeners, when you have a toothache or you have any pain, the advice is not just about teeth alone. Just go to the hospital. If the condition demands medication, then the specialist will be able to examine you and diagnose you and advise you appropriately. Don't just wait and go to the pharmacy. Today you buy paracetamol, the pain persists. You go back and buy ibuprofen, the pain persists. You go back and buy cataplasma, the pain persists. Up to tramadol. So what kind of life do you want for yourself? By the time your body system are getting used to all medication, there comes a time that drugs will no longer be relevant. So I advise our listeners, whatever you will do, try at all costs. When you experience slight pain, make an appointment to the hospital. Thank you.
And thank you, specialist. Apart from this issue of either punch or accidental occurrence, I can notice that some individuals, this front lining, is it the incisors you call it? Yeah. You discover that either the top lining or the down part that they project more than each other. What are the causes of this kind of development?
Sorry, once again, what did you say?
What I'm saying, the front lining, the incisors. There are individuals that the lining is not equal. Yeah. Like the down part, you see some projecting up than others, and without hitch or punch or accidental occurrence. What could be responsible for this?
Yes, this is a very good question, but sometimes it happens as a result of heredity. You look at your parents' kind of teeth, the way and arrangement, but those kind of occurrence can also be corrected. The problem we always have is that when our children are coming up, we don't usually look at how their teeth looks like. That's the problem. But when you look at your children's teeth coming out, and by the time they are changing their teeth to permanent, that's by the age of 6 years, they will start changing their temporary teeth to permanent. Observe your teeth. If the teeth are not well arranged, rush them to a clinic, a nearby hospital. Go and ask for medical advice. At times, you will just neglect it, then it will affect the child in the future. So when you realize you have such thing, the remedy to such kind of condition, we wear braces for the patients or for the people. But you need to come early, because when you now leave it, when your nerves are already matured enough, while wearing braces, you might likely lose some of them. So we advise people to do it in time.
Okay.
Thank you.
Thank you. And please, our time is fast running out, so you kindly say farewell to our listeners so that we can take some of our announcements now.
Okay. Yeah. Thank you for listening to our programs, and I believe that you will make an appointment with us in the hospital to make sure that we restore your smile back, because without smile, I don't think even worship can be accepted to God. Thank you for listening. I remain Habila Gayus Kombo. I'll see you in the hospital. Thank you.